Managing high blood pressure is a lifelong commitment, and for millions of people around the world, medication plays a crucial role in keeping those numbers in check. However, even with the best intentions, it's easy to make mistakes that can undermine your treatment and keep your blood pressure higher than it should be. Let's take a closer look at 7 common blood pressure medication mistakes that could be keeping you sick, and what you can do to avoid them. First, one of the most frequent mistakes is skipping doses or not taking your medication as prescribed. Life can be hectic, and it's easy to forget a pill here or there. Sometimes people intentionally skip doses because they feel fine and think they don't need the medication anymore. But high blood pressure is often called the silent killer for a reason. You might not feel any symptoms, even when your blood pressure is dangerously high. Missing doses allows your blood pressure to rise, increasing your risk for heart attack, stroke, kidney damage, and other serious complications. The key is consistency. Set reminders, use pill organizers, or link your medication to a daily routine so you never miss a dose. Second, stopping your medication without consulting your doctor is a serious mistake. Some people stop taking their blood pressure medicine because they're worried about side effects, cost, or because they simply feel better. However, abruptly discontinuing your medication can cause a dangerous spike in blood pressure, known as rebound hypertension. This sudden increase can put you at immediate risk for life-threatening events. If you're experiencing side effects or have concerns about your medication, always talk to your healthcare provider. They can adjust your dose, switch medications, or help you find solutions to make your treatment work for you. The third mistake is not understanding how your medication works or what it's supposed to do. Blood pressure medications come in many types, including diuretics, beta blockers, ACE inhibitors, calcium channel blockers, and more. Each works differently and may have unique instructions or side effects. Some need to be taken with food, while others are best on an empty stomach. If you don't know what your medication is for or how it should be taken, you might not use it correctly. Take time to learn about your prescription. Ask your pharmacist or doctor questions, and read the information that comes with your medication. The more you know, the better you can manage your health. Fourth, mixing blood pressure medication with certain foods, supplements, or other drugs can be a hidden danger. For example, grapefruit juice can interfere with some calcium channel blockers, making them less effective or increasing side effects. Over-the-counter painkillers like ibuprofen and naproxen can raise blood pressure or reduce the effectiveness of some medications. Herbal supplements, such as licorice or St. John's wort, can also interact with blood pressure drugs. Always check with your healthcare provider or pharmacist before adding new foods, supplements, or medicines to your routine. They can help you avoid dangerous interactions and keep your blood pressure under control. The fifth mistake is not monitoring your blood pressure regularly at home. Relying solely on occasional readings at the doctor's office can give you an incomplete picture of your health. Blood pressure can fluctuate throughout the day, influenced by stress, activity, and even posture. Home monitoring helps you and your doctor see how well your medication is working and whether adjustments are needed. Invest in a reliable home blood pressure monitor. Learn how to use it correctly and keep a log of your readings. This information is invaluable for managing your treatment and catching problems early. Sixth, neglecting lifestyle changes is a mistake that can undermine even the most effective medication. Blood pressure drugs are important, but they work best when combined with healthy habits. Eating a balanced diet low in salt and rich in fruits and vegetables, maintaining a healthy weight, exercising regularly, limiting alcohol, and quitting smoking are all vital steps. Some people make the mistake of thinking that medication alone is enough, but lifestyle changes can reduce your need for medication, improve your overall health, and lower your risk of complications. Finally, failing to communicate openly with your healthcare provider can keep you from getting the most out of your treatment. If you're experiencing side effects, having trouble affording your medication, or struggling to fit it into your daily routine, don't keep it to yourself. Your doctor or pharmacist can offer solutions, whether it's switching to a different medication, finding generic or lower-cost options, or suggesting tools to help you remember your doses. Building a partnership with your healthcare team ensures that your treatment is tailored to your needs and that you have the support you need to stay healthy. So, what can you do to avoid these 7 common mistakes and take control of your blood pressure? Start by making your medication a non-negotiable part of your daily routine. Use technology, such as smartphone alarms or apps, to remind you when it's time to take your pills. Keep an open line of communication with your healthcare providers, and don't hesitate to ask questions or voice concerns. Educate yourself about your medications and potential interactions, and always check before adding anything new to your regimen. Make home blood pressure monitoring a habit, and bring your readings to your medical appointments. This gives your doctor the information they need to adjust your treatment and catch any issues early. Don't underestimate the power of lifestyle changes. Healthy habits can make a significant difference in your blood pressure and overall well-being. And remember, you're not alone in this journey. Your healthcare team is there to support you every step of the way. Managing high blood pressure is a marathon, not a sprint. By avoiding these 7 medication mistakes, you can keep your blood pressure under control, reduce your risk of serious complications, and enjoy a healthier, more active life. Take charge of your treatment, stay informed, and work closely with your healthcare team to achieve the best possible results. Your heart and your future will thank you.